welcome. I am here today with Dr. Orli Peter, and she is a doctor of psychology and has some special postdoctoral degrees. Would you like to share that with us?
Sure. So I'm a clinical and neuro psychologist, and I have 3 postdocs in social psychology, neuropsychology, and clinical psychology.
Which makes you super smart and an intellectual genius emotionally and other ways.
No. But at least I'm smart enough to know no.
I think that's what all of the people say who are emotionally intelligent. They recognize their own flaws enough to say, listen, I'm not the end-all be-all.
Yeah, and a flaw in one area can be a strength in another area.
It's true.
You know?
It's true.
Yeah.
So I know you've done some studies and you're really working well with your people after October 7th. And I wonder what you would like to share with us about that.
Wow, there's a lot to share, but one of the things that we were talking about was, there's different factors that go into making people more likely to get PTSD. That's what everybody asks about. And there's different stages in the treatment of PTSD. So when we first treat somebody, their nervous systems are usually on fire. That's a poetic way of saying we look at the brain functioning and we see in their brain functioning that there's a lot of dysregulated, desynchronized, fast wave activity, particularly in the frontal limbic areas deep inside the brain. There's a lack of communication between areas in the brain that create networks for paying attention, for being able to regulate our emotions. So there's a breakdown in the relay of communication that we can see when we look at the brain.
Is this where people say that they're out of their body when they've had a difficult experience? They're having a hard time basically connecting their mind experience with their body experience?
Yeah, one of the things with PTSD is that you're fluctuating between being either hyper aroused and, so that you're just agitated, or you get this numbing kind of experience where you're completely disconnected and disintegrated. And you can fluctuate back and forth between those states. But one of the things that we look for when trauma treatment is finished and we know we're getting close to being done is that people are reconnected back to their bodies again.
Oh, wow.
That the flow, of information is working really nicely, and people, they'll notice it. They'll say, I'm feeling different, like in my body.
Mm. Now you do brain mapping. Would you describe what the process, what is the science of brain mapping, and what can it tell you?
So we do something called a QEEG, which is a quantitative EEG, and that's different than an MRI in that it's looking at the electrical communication of the cells in the brain. And if you think of the cells in the brain as speaking to each other in a certain language, that pattern of electrical firing is the language that the cells speak to each other. And so we look at that language and we compare it to people who don't have PTSD.
And that's where your people hear about the different wave types, et cetera,
Yes.
correct?
Yeah, so one of the basic things that is looked at is how fast or slow the waves are, but there's a myriad of other variables too besides fast and slow. The type of waveform, how it's communicating with the cell next to it, just various kinds of things, how powerful, not just how fast, but how powerful it is. So there's all different kinds of measures that we look at, and the bottom line is that we compare it to what we call a normative sample, meaning people who don't have PTSD. And we know this over many years now, like what a normally functioning brain looks like. And people who have PTSD don't have that type of communication and brain functioning, which is why we see when we look at them from the outside, nobody's looking at their brain functioning when you're talking to them. But when you see them on the outside, you can tell there's a this, or there's a this, or they're on a hair trigger. Something small can happen and they can really overreact. There's all different kinds of things that we see as humans on the outside that can be shown on the inside.
So how can you tell the difference between someone who maybe has poor temper control and someone who has PTSD, or someone who is depressed and someone who has PTSD response?
So there is some differences, but there's an overlap. So we can't all the time, and it doesn't matter, because if they have something like that, it's still, we can still help them. We can still bring it down.
Good point.
Yeah.
So you were talking about some of the Nova survivors and some of the people. Your country's at war, and it affects not only the people in Israel, but also the people throughout the world, because it seems like it's been open season on the Jewish people now.
Yes.
And we would invite you to just tell us what you see your people experiencing during this time.
So it's a little bit different, those in Israel than those outside of Israel. But in Israel, obviously, everybody knows somebody who was directly impacted by the invasion and the, assaults, mutilations, murders, all of that. So we're seeing either people that were directly affected by it, meaning that they were part of the victims in the Hamas attacks, or the family members who, vicariously were impacted.
Even just watching the videos of some of them, which I know some of the ones we've seen haven't even been the worst of the worst,
right.
But what we've seen has been
right.
horrific.
Yeah.
That, just knowing that wasn't staged, it wasn't a movie, they were actual human beings in the last moments of life.
Yeah.
Is difficult. I can only imagine what it must have been like to be there.
Yeah. And to be there not knowing for many hours, sometimes days or weeks even, so to carry that level of anxiety and stress and worry and hope and not knowing where to land. Your brain can't just land in a place so that it can process. It's constantly in turmoil.
And it takes tools, as they say in your trade, tools in your toolbox to know how to process all of that and what to do to bring a sense of normalcy back to life.
Yeah. So it's hard right now because, the missiles are still flying, and there's not a safety yet for most people in Israel. And, the P in PTSD is post-trauma, and it's not post yet, it's continuing.
Right. Yes.
So this is a continuous trauma, and typically one of the first things we look at when we do treatment for trauma is to, that the patient needs to be safe. That's the first priority, so that then the nervous system can start to calm down, and now we can start moving the nervous system and everything, all of the associated
Recovery.
things that comes with that. Yeah.
Recovery is by its very implication after all of the problems,
Yeah. So right now we're having to do it when there's not an external safety. And this is why, some of what we're doing with we're doing high-tech treatment right now with devices to kind of come in. We're actually hacking the nervous system with these little tiny electrical devices so that the nervous system starts obeying the energy that we're giving it and starts relaxing.
It reminds me a little bit of a TENS unit,
It's similar.
which is something, for those who may not know, that you hook electrodes up to the muscles and stimulate the muscles to contract and relax, or to contract and to stop contracting. But that's what it reminds me of, what you're describing.
Yeah, so I actually, oh no, I don't have it here right now. I did this morning, but there's different things. So one, I think the closest thing that would be similar to what you're describing is we do use a unit that electrically activates the vagus nerve in the body. And the vagus nerve goes, it's the 10th cranial nerve. So it goes from the base here, down your neck and into all the major organs in your body. So it's one of the most important nerves in the body. And when we're stressed, the vagus nerve is not stimulated. It's kind of counterintuitive, because when you stimulate the vagus nerve, it actually relaxes you. So we do have a device that you can kind of hook in right here to the tragus part of your ear. I'll show it where the camera is, over here. And it just sends, it's a very simple device. It just sends a current down through all the different nets in the vagus nerve to relax the heart, relax the stomach so digestion can start occurring.
And that's hooked to the parasympathetic nervous
Yes.
system,
Yes.
so that it renders the opposite. It's there's a light and shadow in the nervous system. One of them is sympathetic and the other is parasympathetic.
Yes.
The sympathetic is what causes the fight and flight.
Yes.
Parasympathetic is the one that says, okay, time to chill out.
Yes.
Yeah.
Yeah. So that's one of the things. That's an important thing, because you're not going to be able to sit and do treatment if you're very hyper aroused. And we saw that when we first started to work with the Nova survivors. They couldn't even sit long enough to fill out the intake. But then, there's other things that are also important. It's not that hard to relax the nervous system, actually. We can do that in just a few sessions. It's pretty easy to do. But then in terms of getting, into the higher levels of the brain, where emotional regulation or attention, to be able to solidify attention, executive functioning, all of that, we need other kinds of equipment to activate those networks, or deactivate, actually. Not deactivate, but reduce activation.
So here's a more practical question for some of our listeners who maybe are not Jewish and are not experiencing the kind of difficulties and traumas that you guys are experiencing right now. How can they be helpful? How can they support your communities during this time?
So, that brings us to the second part of your question about, the diaspora, the Jews, that live outside of Israel, who didn't undergo what the people who live in Israel underwent. And they weren't only Jews in Israel, because 20% of the population is Muslim, and then there's Druze and there's Christians in Israel, and they are traumatized as well. And we're actually working with Bedouin Muslims who lost 21 people on October 7th. But people who live outside of Israel, the Jews who live outside of Israel, I think what was the most traumatizing, and I don't want to overuse the word trauma, the most anxiety provoking, was seeing the glee and the justification that happened almost immediately afterwards, like on October 9th and 10th. There were celebrations, across the country, across, major cities in Europe. that were justifying it and
celebrating
and
it.
celebrating. The glee that they had as they were talking about it was chilling. Yeah. And to see it happen in just like a couple of days, that all of a sudden this explosion of glee for evil.
Mm-hmm. It was almost dehumanizing of the Jewish people again. That kind of animalistic, demonic behavior would be normalized or celebrated, really created a huge disparity in my mind between the types of people groups that we're dealing with. There's one with humanity, and there's another that views that it's okay to do the kind of horrific things that were done to the victims in Israel.
Yeah, and I want to emphasize the separation between, lots of people can find justification. It's not that hard. You know what I mean? You can find justification for anything that you do.
I don't know how they find it for that, but
they do.
They do.
But what was chilling was, you can't lie. I mean, when I say the justification, I don't necessarily mean that they necessarily believe their justification. They may or may not. But you can come up with a story about that. And some of them may believe the justification. But what was undeniable to, I think, most people, the emotion around it. It was the glee that was chilling, because that doesn't lie. And
you
that
could
was
see
frightening.
it in their countenance. Their face looked happy, looked excited,
Some of them
exhilarated.
even said they were.
Exhilarated.
Some of them said, some of the leaders, said that this was a great day, that it was that they were exhilarated by it.
Talk about a bloodlust.
Mm-hmm. Yeah.
What can people who want to help, what are the wrong things to say to people, to Jewish people during these times? What are good things to say? Because a lot of times people are well-intentioned during times of other people's grief, and they try to say something helpful, but they don't have the words. And then, so they, hoping that they won't hurt or make things worse, they just kind of stay silent.
Yeah, yeah.
And I think that a lot of times when I hear the Jewish people say, where are all of our friends? It may be that some of them are scared to speak out, but I think also sometimes people don't really know what to say.
Mm-hmm. So, if I can, just backtrack to explain.
Okay.
So that people don't memorize words, because if they do that, it's going to come out hollow.
I do want to say they shouldn't say anything that doesn't resonate with them. Like if they hear something and say, yes, that's how I feel, but don't script. Yes, we don't want to script anything. We want for people to be able to identify the feelings and to make sure what they're saying doesn't sting the intended recipient.
So here's a guideline. Since one of the most important initial things is that people need to feel safe, because what happened with the Jews, outside of Israel, around the world, all of a sudden the Jews around the world didn't feel safe seeing what was happening with these riots and protests. And anything you can do to help somebody feel safe is going to help them, and they're going to love you. And you can have them feel safe just by letting them know that you feel bad about what happened, because then they know, okay, you're an ally. Like, you feel like our hearts are together with this. Just that is powerful. So anything you can do to let them know you care is enough.
Thank you. What you're doing, the work that you're doing is so important. And as we see things get, unfortunately, what seems like farther and farther away from a peaceful resolution. The longer the war wages in Israel doesn't necessarily mean the sooner it will stop to me. I mean, it makes sense that it would, but what I see is it creeping out into the other places in the world, not just in Israel and the surrounding countries. And so, as encouraging as I want to be, I'll say that your people have always survived, and you will always survive through the years, and that there are friends throughout the world that you don't know are even there, and that there will always be friends of Israel, always be Ruths, always be those who want to be on the side of what is good and what is just. And your people have been some of the most amazing justice seekers in all the world. And your philanthropy, your contributions to society do not go unnoticed. So thank you for your work to help people recover into a place of emotional safety, and thank you for everything that you're doing. Very good at what you do, I know. I've seen your resume, it's very impressive.
I want to thank you because you go a step further in terms of making the Jewish people feel safe. There's an emotional safety, which is important, which is what we're sharing that the public can do. But you are beyond the public. Like, you are actually going out there and teaching us how to be safe. You know, teaching us how to prepare and how to be safe, how to get out of, situations that are dangerous. And that is so empowering, and that can help reduce the severity of PTSD for people. So thank you for that.
Thank you. I know that for me personally, having those skill sets makes a lot of difference in my mental peace.
Yes, because anxiety it's a relationship. It's a relationship in perception. It's like you see a threat out there, and the threat can be a huge threat, but if you're bigger, if you feel bigger than the threat, you're going to have less anxiety. And correspondingly, the threat can be a tiny threat, but if you feel smaller than that, you're going to have a lot of anxiety. So you're helping us feel big.
Well, all it took for David was one little stone. I mean, that was a big giant. May we be the stone you pick up.
Amen.
But it's the faith that your people have, and the relationship, the fact that you're chosen to carry the name of Creator, that, will be your stone any day. Thank you.
Thank you.